Welcome to our webinar with the Support Workers Association of Australia, and that is a mouthful. So you guys go by SWAA,
Wow, we do.
which sounds very suave. Um, but before we get started, in the spirit of reconciliation, Alongside Families would like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people joining this webinar today. For those that I haven't met, my name is Bree and I'm joining today from the lands of the Murrumarang people on Yuin country. I do encourage you to share what lands you're joining from in the chat if you do know. Okay, so finding a support worker can feel overwhelming. We want someone that's skilled, trustworthy, and who truly understands our family's needs. But how do we know who to trust? Today, we're diving into what makes a great support worker, and hopefully by the end of this, having some practical tools to make confident choices for your family. I'm really excited to introduce the Support Workers Association of Australia, who for the rest of this webinar, as I mentioned, we will be calling SWAA, a new organisation that's working hard to raise standards in the sector. We're joined by Carly. Hi, Carly. Thanks for being here. Carly is the founder of SWAA and director of Beyond Boundaries Rehab, and you have over 18 years experience as an OT and extensive experience in support work as well. So you've seen firsthand what works and what doesn't, particularly in that disability support space. So whether you're new to navigating support services or looking to improve your current arrangements, this session is going to give you some insights. So I'm just going to hand straight over to you, Carly, and tell us, SWAA, enlighten us.
Thank you so much, Bree, for having me today. Thank you all for joining us on the webinar. I'm speaking to you today from the Awabakal lands. We're up in the Hunter Valley, so I'm thrilled to bits to be here. So welcome to Safe and Skilled Support Workers. As Bree said, my name is Carly. I am an occupational therapist, is my clinical background, I guess. I've worked in the disability sector for well over 25 years between support work and as an occupational therapist. I am the owner of a beautiful little clinic. I love to call it a beautiful little clinic in Newcastle called Beyond Boundaries Rehab. It's a multidisciplinary team that has OTs, speechies, physios, and allied health assistants. So I'm really lucky to have a beautiful team there, and I'm lucky to be able to work side by side with support workers in that role and to have been a support worker in the past as well. And I guess through that role, we have recognised that there is a huge skills shortage in the community in terms of support workers, and they have probably what I think is one of the most important jobs out there, but also one of the most undervalued and underskilled or underbacked jobs as well. So we're on a mission, I guess, to launch an association and provide support workers with the backing, the skills and the qualifications that they need to do their job, but also the respect that I think that they deserve. And hopefully the flow-on effect of that is better outcomes for the people we're supporting. So that's a little bit about why the Support Worker Association was started, or SWAA was started. Whether you're here because you're in a regional town and can't find the right worker, or you're thinking about hiring a support worker directly, or you're just sick of the guesswork, you're in the right place. So today is all about giving you the tools, the tips and the legal smarts to build a safe, professional and sustainable working relationship with your support workers, and knowing where to go when things get tricky. And I've forgotten that I have a presentation and I have to share it. So,
I was about to jump in and say, do you want to share your presentation?
I really do. Hopefully everybody can see that. If I get off track, I apologize. I also have ADHD and I tend to get a little distracted and forget where I'm up to with things. So feel free to throw questions at me as we go. All right. So safe and skilled support workers. Why does this even matter? So let's be real. The support worker industry is a little bit like the wild, wild west at the moment. I'm assuming that I can see a lot of heads nodding if our screens and cameras were on. I don't know how much experience the people listening here today have had with support workers, but at the moment in Australia, under our current legislation and rules, there are no mandatory requirements for any qualifications. There's no minimum regulation. The families are expected to know somehow what to look for, what to pay for, and what you should be putting in writing when you engage a support worker. And often, if you're not self-managing your funds or engaging them directly, then you're relying on a support coordinator or a provider to know all of that information. And the same thing goes. Often the information is blurry and it's confusing, and we don't always get accurate information. So those of you who are self-managing your NDIS funds, you've got more hats to wear if you're employing your support workers directly too, because you are then now not just a mum or a dad or a parent or a grandparent who is supporting your young person and looking for supports and actioning the NDIS plan, but you are also now a recruiter and a trainer and a payroll officer and the HR manager. And that's even before you've had your coffee in the morning. So if we get this right, we're not just ticking boxes though. You're protecting your family, your workers, and also your funding. So you're creating the kind of relationship that will actually work long term. So how do we find the right fit when we're talking about looking for support workers? And this is really important. And I think these are, when I reflected on this and I sat down and I really nutted this out, to me, these are the three most important things that we should be considering when we're looking at recruiting support workers. And the first one of that is around values alignment. Do they get your family's goals and values? What sort of person are we speaking to? And I would encourage everybody to be doing an interview with support workers and asking them these questions. What are your values? You know, and give them scenarios that may help draw out what those are, and be really clear with what your own personal and family values are before you go into that as well, because it helps you find someone that's going to match yours. They don't have to be the same values as yours, but they have to be values that align with yours and how your family works. A really good way I find of really deciphering that is asking people to talk to you about what would happen if they weren't acting in line with a particular value that's really important to you. How would that feel for them, and what would that look like? And sometimes that can give you a really clear indication of one, whether or not they're being truthful or telling you what you think they want to hear, and two, is it genuine? The second thing is skills and training. Are they safe and capable in the supports that you need? Now, as we said before, there's no minimum requirement for any kind of skills or training, which makes that question really hard. What are we looking for? And I guess at the moment, across Australia, we have a Cert 3 and a Cert 4, so in disability studies and individual supports. And they're great. I would recommend that all support workers should have to have a baseline level of training. My theory or my belief is that if we are going to show up at a job, regardless of what that job is, whether it's in retail or it's in hospitality or it's in support work or health, we are engaging in a job that we're being paid to do. We have a responsibility to show up with the baseline level skills that are required to do that job well. And I would argue in this industry, baseline's not good enough. We're supporting our most vulnerable people in the community, I think. But if we can start at baseline, that would be amazing. And so we have a Cert 3 and Cert 4 available. A lot of support workers have not done those two certificates because there's a cost barrier to getting through them. And also a lot of support workers, when they do them, cannot find the professional placement that they need to do to complete for their practice placement. And so that's a massive barrier in completing it. So they've paid all this money to go and do the training, then they can't get a placement anywhere. And so they can't actually be signed off to have finished it. Just today, I've had 3 people message us on the association's website to say, do you know anywhere I can do my placement? This is where I'm located. I'm really struggling to find somewhere that will take me. And there's lots of reasons for that. The market is, the cost margins within the market and the price guide for businesses are really, really tight. And that's a whole different conversation, but ultimately that means that employers, to avoid paying higher pay rates and overtime and leave, they're employing double the amount of staff to keep their wages lower, and there's less work available for all of the staff that are there because they need to do that in order to maintain their budgets. And that means that there's no extra work for placement, and there's nobody in roles that can supervise them and sign off on their placement. So there's a huge barrier there. So what do we do if we can't access support workers that have a formal qualification? So there is heaps of training out there that is actually free and really good quality. And my first place that I would suggest for you to send your support workers is some training called Active Supports Training. It's beautiful training. It's been developed by La Trobe University. It's research backed. And it is brilliant. It's just real and it's easy to follow. There's no excuse for not getting through that training, and it's incredibly meaningful. So, and free and online, so they can do it in a short amount of time. So I would recommend all support workers as a baseline should have to do that training. If you look at particular associations, like Down Syndrome Australia has some amazing resources on there and incredible training as well. So there's lots of places. I know Fragile X has incredible training as well. We've had a chat with them about hosting some of their training. The Centre for Intellectual Disabilities has amazing training as well. And again, it's online and it's free. So in theory, there's no excuse. There is training available out there if you look hard enough.
Marlene,
After that,
jump in, sorry.
yeah.
That particular, the active supports training, will you share the link that we
Yeah, I would. I
There's
love
just been
that
a few
training.
questions already in there in the chat.
Yeah, and it's when you Google it, it's hard because lots of companies talk about active supports training, but don't necessarily provide it. So finding the right place to access it is a little bit tricky if you just have a quick look. So I'll definitely send the link through. I think the website is something like Every Moment Counts. Um, in terms of like a baseline level of qualification as a formal qualification, you would always want your support worker to absolutely have a first aid certificate, CPR, and I would suggest also mental health first aid training, because that first aid training, the mental health first aid training, also equips the staff to deal with all of the other things that come up. And it also helps with them maintaining boundaries. It helps with them maintaining professionalism and really understanding the needs for a family as a whole and how to respond in different situations. So I would say those three, you definitely want them to have. I've lost my train of thought. Oh, and then the next thing, of course, is the association. So we offer through our association, I think at the moment we've got about 45 modules, 42 or 45 modules in our platform that are all completely accessible for all of our members. They're training that they can do on demand. They get mentoring included in our membership as well. So if you are looking for a support worker and they say, I'm a member of the association, my hope would be that that support worker is automatically going to, they're showing commitment to professional development and lifelong learning. You know that they've got backing, and you know that they've got access to support if needed, if something happens. So I would hope, and if ever you are working with a support worker who is a member of our association and you feel that that's not the case, please reach out and let me know so that I can tweak what we're doing in our program to make sure that we are meeting the needs of the community. The next thing that we want to look at if we're looking for the right fit is someone that can maintain boundaries or is aware of what their professional boundaries is. We're talking about a role that requires us to be in the most intimate moments of our lives. As a support worker, you are there for all of the grit, the nuts and bolts, the everything. And so being able to stay in that space and maintain those professional boundaries still is incredibly important. And so there's some really good examples of why that's important, because often we end up with support workers who are, if you're in a regional or a rural area, you will often end up with a support worker that's someone you already know or someone from the community. And that's okay, and that's beautiful. There's nothing wrong with that. And then we have support workers that stay with us for a long time. And so we often hear them referred to as being part of the family. They are like part of the family. And often in allied health, that happens too. We're with families for a really long period of time. We do become part of their family. I guess as an allied health professional, we have the training and the backing to understand and know what that means in a clinical setting and where those boundaries are. We're talking about support workers today, and they don't have the training and the backing to understand how to maintain those personal and professional boundaries. And so what we can see happen sometimes is those lines become blurred. For you as a parent, that puts you in a really tricky situation, because ultimately, if something's not going well, or your child's needs change, or your family's needs change, you have to be able to have a conversation with the support worker about that. And when our support workers are like family, that becomes really hard to have those difficult conversations. So I would suggest from the beginning making sure that the people that you engage in as your support workers are people that you feel safe and confident to have those difficult conversations with, and you know that you can maintain professional boundaries and that they will too without overstepping the mark. Some things that come up regularly are things like looking after siblings as well. And unfortunately, that's a blurred line that happens all the time because they're there because they want to help. Families need the help too. And we have an unwritten arrangement where we say, yeah, we'll leave all the kids with you, but you're really funded for this one. And unfortunately, from a legal perspective, and I hate saying this to people because it's like soul shattering. Why can't they have all of them? I love them. They're amazing. They're so good with my kids. But if something were to happen, the legal implications of that are huge, and they wouldn't be covered. So I think there's lots of things like that need to be considered in terms of boundaries. Is there any questions coming
Yeah,
up yet?
there is actually.
Oh, shoot.
A few people have kind of commented around, the safety training or children's checks. Like,
Yeah. Oh, of course. Yeah.
do support workers have to have them legally, or is there nothing to say? I mean, obviously we can request that our support workers have that, but is there anything in that there's nothing, is there? There's no regulation to say they have to have a working with children's check.
It's gut-wrenching, but no, if they're not a registered provider, there's no rules or legislation that says that they have to have an NDIS worker screening check or a child protection screener, which I should have mentioned before. I would be, as a parent, I would be asking for both of those things, or a police check and a child protection, the child working with children check screener.
Yeah.
Yeah.
Um,
As a minimum. I think it's incredibly important. The working with children check actually means nothing unless you can log in and actually check it. So we can get a clearance number, and that clearance number lasts for 5 years, I think. But as an employer, I have to log in regularly and check that those numbers have not got any, so the number's still valid and they're still cleared. That can change if something happens or a report's made against them, but if you don't go and check, you won't know. So it's important to make sure that you do that. And you can do that in New South Wales, you do it through Services New South Wales. So I just have to check the other states for you and I'll send it through.
yeah.
Yeah.
That's something I only learned recently that, that you actually have to go in and physically check that number.
Yeah. Yeah.
Yeah.
And it's a really, really important thing to do because when things go wrong, it's catastrophic. It's devastating. It's huge. And they can go wrong, and they often go wrong with the people who are the closest to us. So
Yeah.
definitely really important to do that.
Yeah.
Good.
We have had a suggestion for another training. Helen said that she finds the high intensity disability support worker training tricky. Oh, sorry. She said the National Disability Quality Safeguards website modules don't cover the true live training. So sorry, it's not a recommendation. It's just
A comment. Yeah.
and
And it's true. That's really true. The training that you can do through the commission, I didn't even mention it because it doesn't, most support workers that do that, or some of the other training that's out there that I also haven't mentioned, is the feedback often is it felt like paperwork or information for the sake of it. It didn't teach me how to do my job. It didn't tell me how to be a support worker. It hasn't helped me know what to do when I go to work tomorrow. And that's why active supports training and some of those training that are on the particular associations, the specific associations, it's really targeted knowledge that's really good quality. And the same with the content we've got in the association. Another website that has some amazing content is it's a UK-based company, I think. It's called Open Future Learning. They, even just to have support workers, you could print out some of their posts or socials sometimes and just stick them on your fridge because they really are brilliant. They're really brilliant. More of it's probably adult focused, but there is some modules in there, I think, that are around pediatrics as well. Yeah.
Amazing. Yes, there's definitely been lots of comments about getting the links to all these different courses that you're suggesting.
Yes.
And there just was one question from Kathleen just around, do you recommend that we pay for hours to do the training as part of an induction before the support worker starts?
That is such a good question. And that answer to that is going to be individual to each family. I think there's so many factors involved in that based on whether or not you have the funding available to cover it, whether your staff are long-term staff, are you self-managing and engaging them directly or employing them? I think if you're employing them directly, I think there's more of an argument to say yes, you probably should. part of that too is it's the better trained they are, the better skilled they are, the better outcomes, the safer your family and children are. So my answer defaults to yes, but I also recognize that not everybody has enough funding in their package or extra cash laying around to be able to achieve that either. So I think the answer to that really has to be individualized to each family's circumstances. And maybe another way around that is that you'll pay for their time to do it, but not for the cost of the training if it's a paid course or vice versa. We have had families inquire about who employ their own support workers and they want to have their staff join our association, and that's fine. My theory also is, or there's research around this, is that if someone pays for something themselves, they're more likely to value it and they're more likely to engage in it. Sometimes when we pay for things for other people to do, it becomes a tick box. So I guess it depends on the content. If it's something with really targeted skills that you need them to show up and do tomorrow and it's really specific, absolutely. If it's ongoing learning and professional development, then perhaps it would be more appropriate for them to pay for that themselves.
Awesome.
Hopefully that answers the question.
Yes.
All right. So what happens when boundaries do blur? And we've talked about this a little bit as already. A good example of this, I was speaking to a lady, and I won't say her name because most of you will probably know who she is. She's quite well known, but she's a beautiful, beautiful lady. And she rang me and she said, Carly, I've just had the worst experience and I never thought this would ever happen to me. But she said, I've had a support worker for her son for more than 5 years and they've been amazing. They're a brilliant support worker, like family. There's, so close, regular shifts, all of those things. And then all of a sudden, a conversation came up about pay rates and wanting a pay rise. And this particular person was like, amazing, yes, you deserve that. Let's give it to you. But we've also realized in the process of doing all of this that we actually probably should have had a contract or a service agreement or something with you just for legal reasons and to make sure everything's above board. So I can't pay you what you're asking, but I definitely want to give you a pay rise. Let's meet in the middle. This is what I'm offering, and I also need you to sign a contract. And that conversation didn't go well at all. And all of a sudden, my support worker, or this person's support worker, who is like family, became incredibly difficult. And that relationship broke down, but quite a lot of back and forward emails that were really quite nasty and not particularly kind. And I think when money is involved, at the end of the day, support workers are there to do a job. They're being paid and they might feel like family and they might be involved in all of those really intimate moments of your life, but they're also still there to get paid. And so when things like pay and wages and changes to what you need, or you don't need as many hours, or your funding's got cut, those things can be really difficult conversations and they can go south really quickly. So making sure you've got boundaries from day one, even when it feels personal, is really, really important. They're not about being cold, they're about protecting the relationship and making sure you've got longevity in that relationship as well. All right. Legal responsibilities. If you're employing your support workers directly, do we know if many people here are employing their own support workers or independents?
Just wondering if you are, maybe you could give us a thumbs up in the chat
Yeah,
or a yes in the chat.
because the bit I
We've got a
scarily speak to,
combination. Yes, yeah, there's a couple that are coming through that some are
yeah, I suspect it
combinations.
tends to happen more in families with children than it does in the adults. I don't know why, but
And we've got yes as sole traders.
sole traders. Okay, yeah. So they're a slightly different kettle of fish. But if you are employing your own support workers, and hopefully you guys do know this, but often when I have conversations with families, they don't always know this. If you're hiring them directly, you are their legal employer and you are a small business and you are responsible for all of the same things that every other small business is responsible for. So not just what the NDIS talks about. That means that you have to understand the award. You have to be paying on the award or above. And you need, and the Shads award is so complicated. We had this conversation the other day, didn't we, Brie? It's so complicated. It's so easy to get it wrong.
And I've seen a question in the chat, which is exactly the question I had to you. Like, have their own ABN, do we have to do all that stuff?
Yes, if they're contracting to you and you are, if you have an ABN or an ACN, then my answer is yes. Um, you are a small business. And then the lines get blurred with whether or not they're actually a contractor. So you have to pay their super, their PAYG, their workers' comp insurance. You have to keep employment records and be compliant with that. You're responsible for Cybersecurity and Privacy Act and all of those things as well. And that goes, it's not just your family's information that needs to be secure, it's also their information. If you are holding contact details, phone numbers, bank details for payments, that sort of stuff, you're also responsible for making sure that you're compliant with that. And then obviously workplace safety.
And I think if I'm correct, there is something on the ATO where it helps you determine whether they are a contractor
Yes.
or
Yep.
yes. Yeah.
And then the one other thing to consider is that as of the 1st of July this year, portable long service leave rolled out. So we did a webinar on this yesterday, and that means if you are employing staff where your business, regardless of how small or big it is predominantly in community services. So if you're employing support workers, then you are, doesn't matter what award you're paying them under, you are responsible for paying 1.7% of their wages into portable long service leave from the 1st of July. And that is mandatory, but it's also an opt-in process. So if you don't go and opt in, you won't be paying into it and you won't be reporting to it, but you will get caught eventually, and that will all have to be back paid. So the first reporting period is April. I can give you the link to their website too if people need that. They've got a really great tool on there and a resource you can download that has an Excel template on how to track what to pay and what to do when it's time to register and opt in. Well, you can opt in now.
I have no doubt everything that you've just said is actually probably scared quite a few people in the chat, because that's how I felt when we had this conversation.
Yeah.
So, are there any resources or organizations or anything like that that are doing some work around this and making it clear so families can help understand and navigate whether they should be doing all of this?
Officially that I know of, no, but I did speak to a beautiful lady at an expo who I'm in contact with, who is looking at and building a model at the moment to provide a service where you could pay a membership fee to access supports around running yourself as a small business. So when you're self-managing your NDIS plan and you have an ABN and you're employing all of your own workers, that is her target market when she eventually gets that launched, is just self-managing families. Yeah. So
And just
hopefully
everyone listening, be mindful, it's on my radar. So as soon as we have some information around that, we'll look at doing a webinar or bringing in some resources just to clarify what that looks like for
yeah.
families moving forward.
I'm also really happy if people want to flick me through an email if they're not sure and they just want to check that they're doing the right thing. I might not have the right answers, but I'll be able to help link you in with where you need to go in the meantime for specific things. So people are always welcome to reach out. Now, the next little part of that conversation is, like you said, are they a contractor or an employee? Ultimately, we don't decide that. I think we often think we can just pull somebody in as a contractor. It happens in all industries, health as well. And we say that they're a contractor because we're paying their invoice, and that's our arrangement with them. But if you actually spoke to the ATO about it, they would be classified as an employee. So you are then responsible for paying their super, not the worker. So most support workers who are engaged in an ongoing shift where you are setting the hours for them and the tasks, they are classified as employees. If you get Bob to come and paint your fence out the front, Bob, he's a contractor. He can give that job to anybody that works for him or any subcontractor he wants. Your arrangement is not with him personally, it's with him as a contractor or him as a company. He can tell you when he's going to show up to do the job. He can start and finish it when he wants. Even if you say, I want you here on Monday, he might say, I can't get there Monday, but I'll get there Tuesday. Or he might not show up Monday and he shows up at, Tuesday morning or at 3 o'clock in the afternoon on Monday. He can pick and choose when he does that work. So he's a contractor, short term, and it's not ongoing. Someone like a support worker, generally speaking, under most arrangements, will actually be considered an employee, and you are responsible for paying their super. So that's something to keep in mind, because that could be a hefty bill if it gets claimed retrospectively, and it will eventually. It always does. The ATO is cracking down on super at the minute, so it's a big focus of theirs. There is a tool on the ATO website that you can do where it will run through some questions and it will help you figure out, are they an employee or a contractor? All right. Now, what about though if we're not employing our own support workers and we want to look at hiring them? So obviously you've got a few different options. Where can we find good support workers? So direct hire through local job ads, local networks, social media. There's so many Facebook groups around now with support workers in there. I'm not normally a fan of checking out people's social media pages when they apply because I think it's a breach of privacy, and I think what we present on social media is not always how we would show up professionally. However, from a trust perspective, I think it's probably not a bad idea. To have a sneaky look at people's social media pages before you employ them. I know most employers do it now. I don't in my allied health practice, but in this scenario, if I was employing support workers, I absolutely would. And I think that comes back to that values as well. You've got platforms like Mabel, Hire Up, Kind. There's so many of them now. What I would suggest with those is that you check the fine print. They generally come with insurance. The support workers are covered by that platform's insurance. So I'd want to just know that what does that cover and does it cover it properly? Often things like for example, medication, if we are administering medication as a support worker and not documenting it in the right way and we don't have the right training or qualification behind us. So there's no mandatory requirement for training. However, if we don't have that training, something goes wrong, the insurance is null and void. So I would just be checking that they've got insurance, that they understand the content of their insurance and that they know what things, policies, procedures, and things that they need to follow with that. And if they are coming from a platform, who's the employer? Are they employed by the platform or are they a contractor to the platform or, yeah. Host agencies. So that's where they employ the worker, but you choose who works for you. And so that's a provider. My recommendation too is request that you guys get to interview. You get to choose. So don't fall into a situation where a provider says to you, I'm sending Sally on Tuesday because that's who we've got available. Ask to meet the team, ask what the options are, and help find someone that is. And if the company says no, we can't do that, this is the only person we've got available, I would say they're probably not the right company for you. Move on. Find somebody else. Yeah, find someone that's happy to work with you to find the right match for your family. Word of mouth, and in regional areas, this is gold, right? But I would still put agreements in writing. Yeah. All right. Self-managing NDIS funds gives you the most choice, obviously. It comes with the full responsibility, but you don't have to act as an employer. So you can hire registered or unregistered workers. You help set their pay or negotiate that with them, choose the training that they may do, but you have to keep detailed NDIS records. It's like running a small business. You still need systems, policies, and a paper trail, but you don't have to have the ABN. I have conversations regularly with independent support workers, and their question to me in mentoring 9 times out of 10 is, what do I do to make sure I'm doing the right thing, to make sure I'm compliant? They actually do genuinely care. A lot of the time they get a bad rep, but most of them really do want to do the right thing. And something we talk about regularly is making sure that they have their systems and policies in place. Even though they're independent, they still need to have paperwork. They need to have procedures, policies, and processes documented so that they're covered and they're protected. And that will include things like exchange of information consent, an intake form, consent to receive services, not just their service agreement. So if they're doing a really good job and they're being really thorough and making sure they're covering all of their legal requirements, then I would say expect to sign a confidentiality agreement, expect to sign a consent to exchange information. And I would encourage giving them access to the rest of your team if possible, because if the more that they can communicate with the rest of your allied health team or the broader network of people who are in your supports, then the better the outcomes for all of you are, the better they can do their job as well. So I would hope that they all have those things in place. We've talked a little bit about training and professional development, but a skilled worker doesn't just rely on their lived experience or willingness to help. They need training. So manual handling, medication safety, communication, behavior support, whatever your family needs. Yes, you can train the workers you already have. we've talked all about this. I don't know why I put this slide in a second time, but we'll go over it again. Um, Sometimes the best training also is just sitting down and talking through with you guys about what your needs are and what you want a day to look like. And documenting that. It doesn't always have to be formal training, I guess is the other point here. Formal training is amazing and it's valid and it's really important, but them understanding what your needs are, what you want your day to look like, or what you want your child's day to look like, and what the scope of their role is, I would absolutely recommend having a scope of practice or a scope for their daily activities. So they've got a checklist, they've got the things that they need to do, there's boundaries around what they're not expected to do, and where you are expecting them, or what you're expecting them to achieve each shift. All right, is there any other questions in there yet, Brie? Oh, you're muted.
Yes, more just around, just to clarify. So
Yes.
self-managing and using a support worker who has their own ABN,
Yep.
then we do or do not need to do the super and leave. There was just a bit of confusion.
Yeah, no, that's fair. If you have an ABN and you are contracting them to your ABN,
Yeah.
yes, you would need
So,
to pay them
but if you
super.
don't have an ABN and you've just got a support worker who has their ABN,
Yep.
we just pay them their rate and we don't have to do super and leave.
Well, I think if you were paying their contracting, are you paying them directly out of their funds? I would think you had to have an ABN in order to have that access to the self-managed funds in that way.
So from a self-managed, like, so for example, we just upload the invoice that they provide
Yep.
and NDIS give us the funds and we just transfer them the money.
And you don't have an ABN?
Nope. And I'm assuming that's what the person in the questions is asking.
Yeah. Then if you don't have an ABN and you're not, I'm going to circle back to this. I'm just going to double check.
Yeah, we might put some information out in the resources to clarify. Helen's been sharing some great resources in the chat around, being a sole trade contractor or an independent support worker with an ABN. So
Amazing.
make sure we share all those links as well. And I think we'll circle back to this conversation as a whole and see if we can get someone to come in and do a webinar on this particular topic. Because
Yeah, our HR person would be happy to do it. She's brilliant. But if you don't have an ABN yourself, then you're not accountable to the ATO or ASIC. So my answer, I'm inclined to say, is no, and I think I'm right in that answer, but I want to check before I really lock
yeah,
that question in, just
awesome.
in case. Yeah, yep.
Absolutely. We'll share some information about that in the resource email.
Yeah.
Great questions though, but it is
Really good questions.
it's
Yeah.
such a grey area and such a tricky space, and it is confusing, and it's hard to find out exactly what we should be doing and making sure we are doing the right things.
Yeah.
And no one wants to be in trouble with the NDIS for doing it wrong. So
No, or the ATO or ASIC or anyone else. It's scary. It's really scary.
yeah,
But yeah, I think I'm inclined to say if you don't have an ATN, you're not accountable for that. No.
yeah.
Okay. We've talked about this,
Yep.
safety, worker screening, CPR reference. Yeah, do reference checks. Don't be afraid to do reference checks. Have a list of questions. You could ask ChatGPT if you needed help to, or Google it around what to ask, but you're definitely looking for, are they good communicators? Were they following procedures and respectful of your requests and actually doing the things you're asking them to do? Were they a bit rogue? Yeah, what you want to really ask some of those values-based questions. But I would encourage you, absolutely, please do reference checks. And if they're not willing to give you their most recent employer's details, sometimes that's legit. Their employer, they might not have a good relationship and they don't want to let them know that they're leaving, but sometimes that's a bit of a red flag too. So yeah, definitely ask who are their most recent employers, and do the reference checks. Put the time into that. Yeah. And have a clear incident reporting process. So if something happens, what do you need them to do to make sure that they've reported that, and so that you know that you've got the information if ever something does happen. And that's the same. Even if you hire someone you still need to go through these safety steps. It protects you legally, it sets the tone, it keeps a professional relationship and role. That's it. Now I
Okay.
just have my Q&A.
Yeah, we'll have a few questions because I know we are over time.
Sorry.
Have had a question around are there guidelines around when a support worker's duty becomes high intensity rather than base level? So, for
Um,
example, this person's daughter's needs, drinks need to be thickened, she has seizures and often soils nappies. Are these all things a support worker on a standard rate will cover, or do they fall into a high intensity support worker rate?
I think they would fall into a high intensity support worker rate. Yeah.
Okay. We had another question a little bit earlier as well. Is there a huge difference on going through an NDIS organization to get support workers cost-wise? And I think that probably speaks to that self-managing in that you have choice and like I mean you can negotiate the rates.
Yep.
So in your experience, is it more expensive to go through an organization for families?
I think that that is hugely variable depending on the region that you're in. Yeah, there are some places where it's probably cheaper to engage an independent support worker, and there's other places where it's cheaper to access a company. What I tend to find is that most independent support workers might have a higher rate than what a provider will have, but they probably charge you for way less than what the provider will have. So just be conscious of that too, that it's actually not always the hourly rate. It's what are all the little bits in between that they're going to charge for. Yeah.
Yeah. And then we just had a question from Veronica to say, what if a support worker comes in not regularly? Then I will just pay their invoice for that one shift as a contractor because I needed them that particular time. Um, they could not choose as a contractor to show up whenever it suited them. So in that case, is it okay just to pay that one-off invoice as a contractor if it's just like one of those one-off shifts?
Probably, but I would ask your accountant to confirm that.
Okay.
Yeah.
Um, Is there a way we can go to reference on what is expected in an invoice for an independent worker? Is that something that you guys provide a little bit of training to for
What
support?
they should be putting in their invoices.
Yeah.
Yeah, we provide some training to our members around that. Um, we've probably got about 50-50 membership that is independent versus employed somewhere else, but it's definitely covered. The NDIS website has got some guidelines, I believe, as well around what needs to be included in an invoice. Yeah.
Um, and I just want to share this tip that we had from Alison earlier as well. She likes saving free training options to ask support workers to do if she has to cancel a shift last minute and has to pay for their time. So I think that is a great tip to share.
It's
Um,
a really great tip.
and Helen's asked to share some information. Yes, Helen, always share information. I can share it all in the follow-up email.
Yeah.
All right. Well, I think there's going to be a lot that's going to come out in the resource email. There's lots of links, and we will get some clarity around some of those questions that everyone had. I'm just mindful that we could sit here for ages and talk about support workers.
I was so worried I was going to end up doing it in like 10 minutes. Quick.
Oh, hang on, we've just had one other question. Where would I find details around what falls into high intensity? And as NDIS have only funded standard rate, I guess that means a review.
Yeah.
Is there a
I
place?
think Helen's just popped in the
Oh,
link to the
perfect.
high intensity standards. Yeah.
Awesome. Thank you, Helen. Thank you, Carly, so
Thank
much.
you. Thank you, everybody.
Yeah, I'm sure yes, there's probably still a few questions that we need to answer for some of those people that are watching live. But thank you for the insights and sharing your passion with us today. I really like what the support SWAA is doing to elevate the standards in support work, and it's actually going to make a difference for families and workers alike. It's so nice to hear that there's someone out there questioning the regulations around these people that are working so closely with our families and children. To everyone who's joined us today, I hope you're leaving with a little bit more clarity about what to look for in a support worker, and maybe feeling a little bit more confident about making these important decisions for your family. Remember that the right support can truly transform outcomes, and you deserve workers who are skilled, accountable, and aligned with your values. If you'd like to learn more about the Support Workers Association of Australia, or to connect with qualified support workers or to explore how SWAA membership might benefit your workers, please check out the resources that we're going to share in the follow-up email and have a look at their website. Our next webinar is next week, and it's part of our autism webinar series. The topic is When School is Hard. So in that session, we have a guest speaker, Dr. Siobhan Lamb, who will unpack why school can be a tough environment for autistic students and what families and educators can do to make things easier. So that's coming up next week. In the coming days, you will receive an email which will have a link to today's recording, the presentation slides, which Carly has kindly agreed to share, contact information for Carly and the team at SWAA, those resources that we've mentioned, and obviously ways to connect with alongside families and continue the conversation. But yes, thank you all so much. Thank you so much for your contributions in the chat, for your questions, even the curly ones. And thank you, Carly, for all the work you guys are doing at SWAA. I think it's something that the disability space really needed.
Thank you so much for having me. I really appreciate it.
Yeah, and I'll chat to you soon. Thanks, Carly.
Thanks, everyone.
Bye.